said the peripheral arterial disease, we have atherosclerosis, where there's plaque being formed inside the lining of the tissue of the blood vessel, right? So we have tissue hypoxia. We have the signs and symptoms. We can have occlusion, because as it grows, it closes the space where the blood would have flowed. And we mentioned after it's closed out to 70%, then they're going to have intervention. But if it's before 70%, or if it's around 60, they're going to tell them to do lifestyle interventions, eat better, exercise, change your diet, that kind of thing. And then the patho for the CVI, the chronic venous insufficiency, since it's a valve issue, we know that the valves are supposed to close shut each time they pump the blood. But because if there's overflow or too much blood that they're working with, sometimes the pressure might allow the valve not to close all the way, and that can wear it out. And so we can have impaired the skeletal muscles of the valve. They become impaired and they become lax, and they allow more blood to stay behind, or sometimes they allow like regurgitation, things like that. So it's because of the skeletal muscles that are pumping through the circulatory system. Okay. Now, with peripheral arterial disease, here are some of the things that we're going to see, right? We're going to see discoloration. We're going to have wounds. We're going to have problems with the feet, with diabetes. So when you think of arterial disease, think of diabetics, right? Think how they have paresthesia, they don't have feelings in their toes, they have ulcers or wounds that don't heal, more wounds that don't heal than ulcers. When you think of vascular insufficiency, we have swollen legs, so we have the fluid that's accumulating because the valve is not pumping it back. We have the discoloration. When you think about valves carry deoxygenated blood, we think toxic blood, we think dirty blood, right? Bad blood. So if I think dirty, I think of discoloration, right? That helps you remember the tone changes, texture changes, and non-healing wounds. Also, if you think same with the valve as with the arteries. So the valve, it's like the bad blood is sitting there and it's rotting in a way. That's how I think about it. But there's ulcers there. And then with the arteries, it's because the oxygen is not getting there. Oxygen, nutrients, healthy cells can't grow if they don't have nutrients to do so, right? So they happen in similar ways, but for different reasons, okay? So again, more clinical manifestations with the peripheral arterial disease, supply problem, right? The arteries are not working, or they're not smooth. They're not allowing a good path for the blood to flow. I always think of diabetes when we said all that sugar in the smooth lining is exfoliating and is causing, rather it to be smooth, it's like all ruggedy, and so blood gets trapped and it doesn't all flow. By the time the cardiac output happen, it doesn't reach your toes because they get stuck on the way because of the tortuous road. So I think, supply problem, it's not getting there. So what are we gonna have? We're gonna have pain, calf, thigh, buttocks. So the pain, we remember when we talk about blood carries oxygen, the body needs oxygen to do energy, to have energy, it uses up oxygen while it's working. And so when we're doing aerobic respiration versus anaerobic, so we use aerobic, and once we finish up the oxygen store, the body reverts to anaerobic, and that causes pain. So the brain knows you need to stop working so that we can get more oxygen. So that's where the pain is coming from. So usually with this, and we're gonna see our example, when these people develop the pain, if they stop, right, the activity, the pain will go away because it will give that area of the body time to get more oxygen, okay? So we have decreased pulses, right? Again, we think of diabetes. When you take the pulses of the feet, it might not be very strong because it's not getting there the way it's supposed to, so the pulses are weak. Positional color changes, okay, so moving one side to the other, we can see the change of the color. So if we're gonna see one called Raynaud's disease, where the fingers turn pale, then they turn blue, and then once the blood vessels open up so they can get the oxygen back, it turns really red. So with vasoconstriction, we're going to have decreased blood flow, so we're going to have a color change, paleness, cyanosis. But with increased blood flow, we'll have the flushing, right, which is the red. So there's a color change. So then we have the toes, feet, shin ulcer, right? Blood is not getting there, so we're going to have ulcers. Numbness, again, numbness. The paresthesia with diabetes. Nerves need cells, blood cells need oxygen too. And if they're not getting it, we're going to have a problem. They're not going to be healthy. You're not going to feel, right? So these are arterial problems. Then we have chronic venous insufficiency. So it's a return problem. So it's not going back, right? So we know AA, arteries away from the heart, and V to the heart, right? So venous is supposed to bring it back to the heart from the lower extremities, but it's not doing so, so it's staying down there. So that's why we have edema. We have atrophic skin. So if it's not doing very well, it'll start, getting smaller, shriveling up, right? We have enlarged veins, dilated. We have discoloration. We have itching. We have swelling, medial or anterior ankle ulcerations. So a lot of these are very similar, but you just have to know the differences why they're the way they are. Okay, so we have more on, so the legs, the CVI, the legs are tired, the edema worse with standing, itching and discomfort. I always say that itching, I'm like, okay, if you're dirty, you are itchy. And so since we call blue blood or veins, their blood that has been used and they're toxic, they're supposed to be going back to the waste, then they're dirty, then they call itchiness. That's how I refer to it. So cyanosis, brown pigmentation of extremities resulting in leathery skin created by pooling of blood in the legs, okay? So here's more on chronic insufficiency. We have the varicose veins. So we know the varicose veins, right? A person who stands a lot, walks a lot, or pregnant women who stand, walk, or just have a lot more blood. You'll find out in OB that women have to create a little bit more blood because they have another body, right? So because they have more blood now, it's more pooling. So they have to exercise, they have to do walking so that they can help with the return of the blood. But if it doesn't happen, then the valves are not closing properly because there's too much pressure, there's too much work they have to do, so they tend to accumulate. And as they accumulate, the vein makes room for the blood that had remained behind, and it just stretches out, right? So varicose veins, darkening, dark and leathery skin, swelling, right? Pain and heaviness, leg cramp or spasm, itchy skin, restless leg syndrome. So we have more on the peripheral arterial disease, artery disease. So this is just saying what we mentioned earlier. So peripheral arterial disease occurs when arteries in the legs become narrowed or clogged. So signs and symptoms, this is an intermittent claudication, right? Legs are tired but improve with rest. Leg cramp, hard to walk, can't walk far, wounds don't heal. So the person with intermittent claudication, right? It's intermittent because it happens, it goes on and off, right? They start walking, they feel the pain, they stop, the pain goes away, they walk again, stop again, walk again, stop again. And they'll tend to come to the hospital when they realize, the distances that they're able to walk without pain is getting shorter and shorter and shorter, right? And so you find out if you have it, we do the ankle brachial index where they take the blood pressure of the arm and the leg, and what that is, the heart is closest to the arm, so they can see the distance between that, and that's further away, they see the distance, and there's an actual measurement as how quickly it should go, right? So we know the concept of blood pressure. It squeezes the artery shut, and then once you hear that first sound, that's usually the systole, that tells us that's the amount of time it takes from the time it was closed to the time it's open, how quickly the blood gets there, right? So obviously, what do? Lifestyle changes. Like with Sergio was doing with our charade game. So don't smoke or try to quit. right? Control your blood pressure, stay active, eat right, all of those things. Okay, what are our risk factors? Smoking. So smoking is a vasoconstrictor, so that's why that's a big problem there. We have diabetes. We talked about how diabetes affects our arteries. It destroys them, and so that's a risk factor. Hyperlipidemia, the fat buildup, the plaque buildup in the lining of the smooth muscle of the lining of the blood vessel. Hypertension, right, with that pressure, it's just going to start ruining the blood vessels. And genetic predisposition, depending on if you have a family with hypertension or diabetes, all of those things can also cause you to be at risk. Then we have for the chronic insufficiency, DVT or family history of varicose veins, right, deep vein thrombosis, obesity, pregnancy, inactivity, smoking, female over 50, jobs where people sit or stand, right? All of these cause some kind of pressure to be applied to the valves, and that causes problems to happen. And with females, the hormones are also an issue too. So let's see. Anything else? So PAD, we have inflammation, infection, and trauma to the arteries. That can affect PAD. And then CVD, also some causes, it could be trauma or vein inflammation, phlebitis. More often, it is a muscle inactivity and gravity that is a cause of poor blood flow, or poor blood return. Diagnostics. How are we going to assess and find if this is a thing, if the person has PAD or PVD? We're going to do history. We need to do the ankle brachial index. We're going to do the ultrasound and angiography. And for the chronic venous insufficiency, also history and the duplex ultrasound. Here's the ankle brachial index. So the ankle brachial index is a ratio of the blood pressure at the ankle, and there's a formula. I'm not going to test you on this, but it's good to